Hi, I'm Dr. Helen Schultz. I'm a consultant psychiatrist and an expert medicolegal examiner. After years of working in private practice treating my own patients, I now work as an independent medicolegal expert. I use my skills and training amassed over the past 22 years to write court reports for people who have been referred by their lawyer. My career so far as a psychiatrist has taught me a lot that has nothing to do with psychiatry. Overall, despite years of advocating, I do see that many of our roles that we have as female psychiatrists are not family friendly. When we move to part-time or to other roles that don't have as many obligations, we're often less remunerated. We miss out on superannuation when we take time out of the workforce to raise our children. And I remember when I became a mother, I didn't have maternity leave. My 12-month contract ended and that was that. And I still hear of that happening today. The best and most flexible public hospital role will still land you on an on-call roster, and your leave will be determined by managers balancing a shrinking workforce. And once you commit to an FTE, that will be it. Private practice can be super rewarding, but again, there's a lot of unpaid work that eats into your time, and it's really hard to take breaks that you need. That's why I believe that medico-legal work is a fabulous career option for women looking to juggle super important roles and be challenged and rewarded. After all, we do make up 50% of the medical workforce at the time of graduation, and we've trained and studied for years to get where we are. I'm not a forensic psychiatrist, so I don't do criminal matters, but I work in the civil injury space. So I assess and prepare reports for people that are pursuing claims for compensation after something has happened to them. I do have extra qualifications so that I can administer rating scales to determine degrees of impairment, but then a lot of my work in historical abuse matters doesn't require me to do that. I love this work as I need to be an expert communicator with writing reports, and writing is one of my big loves in life. I have to also rely on my skills of assessing a patient and often asking questions that relate to events across their whole lifespan. I have to determine if they have suffered a psychological injury as a result of what's occurred to them. And then I need to use my experience and skills to apportion how much this event or incident has contributed to their presentation. I'm often asked about my opinion about how the event or incident has affected the person in many facets of their life, such as their employability or with regards their relationships. At times I may be called to court to defend my report, so I need to make sure that I can back up everything I've written. The purpose of my report is to guide the presiding person, who's often a judge, in making their decisions. I must add everything I deem relevant to the report so that they can do that. I may be called to court to defend my report and be examined by either side. My report is discoverable, meaning that I must inform the person that I'm seeing that nothing can be kept confidential. And that's in direct contrast to my private practice work. Unlike many other areas of psychiatry or indeed medicine, I am well remunerated for my time and expertise. I also hand over the report and my work is done, unless I need to prepare further reports or attend court. I can schedule my work around other commitments, including my work in psychiatry registrar exam preparation and education. I wish I'd thought about this work sooner or had a better understanding of what was involved. But I'm here now. I do have greater flexibility, as well as a chance to catch up financially after time out of the workplace, which is an essential factor for so many professional women who raise their children as well. So if you'd like to hear more or be part of our team, please get in touch.